Welcome. Today, we're diving into the work of Dr. S.K. Singh, focusing on supplier oversight and building supply chain resilience. We'll explore how careful management of suppliers can strengthen the entire supply chain, helping organizations stay strong even when challenges arise. Let's get started. We all know that a medicinal product is only as strong as its weakest link. One contaminated ingredient from an unqualified supplier can trigger recalls, regulatory penalties, and harm patients worldwide. Today's industry faces serious challenges, from global disruptions and geopolitical tensions to counterfeit materials and cybersecurity risks. Add transportation delays and climate impacts, and the complexity grows. With so many players involved, from ingredient suppliers to contract manufacturers and logistics providers, keeping a close eye on every supplier is more critical than ever. When inspectors come knocking, they're looking closely at how we manage our suppliers. They check everything from how we qualify suppliers to how effective our audits are to whether we can trace materials back through the supply chain. They want to see solid quality agreements, clear change notification systems, and strong supplier performance metrics. Across the globe, regulations like ICH Q10 and FDA standards set the bar for supplier oversight. These guidelines all emphasize risk management, approval, and ongoing monitoring, making sure every link in the chain meets the highest standards. Let's look at how we manage suppliers based on their impact and risk. Critical suppliers, like those providing APIs or sterile components, go through a thorough GMP audit and quality agreement before we even buy from them. Meanwhile, less critical suppliers, such as those for stationery, have simpler controls. We categorize suppliers into critical, major, standard, and service providers, each with tailored oversight. Our supplier lifecycle follows a clear path, from identification and risk assessment, all the way through audits, approval, and ongoing performance monitoring. It's a continuous cycle of improvement. When it comes to qualifying suppliers, one size doesn't fit all. We tailor our oversight based on risk. High-risk suppliers get on-site audits every year, while medium-risk ones are monitored remotely and reviewed regularly. Low-risk suppliers are assessed through documentation and periodic checks. We use a risk matrix that considers factors like product criticality, patient impact, compliance history, and even cybersecurity. This approach helps us focus resources where they matter most, ensuring quality and safety without unnecessary burden. Quality agreements are all about clarity, making sure everyone knows their role and what's expected. They spell out responsibilities for good manufacturing practices, how changes get controlled, and how deviations are reported. They cover corrective actions, complaint handling, and recall procedures too. Data integrity, audit rights, communication during inspections, and business continuity are part of the picture as well. For example, a packaging supplier needs to alert the manufacturer before switching raw materials or locations. This helps assess impact and stay compliant with regulations. Let's talk about building supply chain resilience, a vital focus for any manufacturer, especially in critical fields like vaccines. For example, a vaccine maker keeps approved secondary suppliers for glass vials and stoppers. This backup prevents production stops when global shortages hit, but risks keep evolving, from pandemics and natural disasters to political instability, port congestion, cyber attacks, and energy shortages. To stay ahead, companies use strategies like multi-sourcing, supplier diversification, safety stock, digital inventory tracking, predictive demand, regional sourcing, and robust continuity and disaster recovery plans. Let's look at how digital transformation is reshaping supplier oversight. Imagine IoT-enabled temperature sensors tracking cold chain shipments in real time, sending automatic alerts if anything goes off course during transport. This means we get real-time monitoring, full traceability, and early risk detection. Plus, supplier performance can be evaluated automatically, boosting transparency for regulators. Emerging tech like AI, blockchain, RFID, and cloud portals are all part of this shift, making supplier management smarter, faster, and more reliable than ever before. When it comes to inspection readiness, understanding what inspectors expect is key. They often find gaps like incomplete supplier qualification, expired quality agreements, or missing supplier audits. Weak change control and poor traceability also raise red flags. Inspectors dig into approved supplier lists, qualification files, audit reports, and quality agreements. They review incoming material testing, change notifications, and CAPA records. Supplier performance trends, business continuity plans, and data integrity for supplier records are all under scrutiny. Being prepared means staying ahead on all these fronts. Let's look at a real-world example of strengthening supply chain resilience. A pharmaceutical company depended on just one overseas supplier for a vital ingredient, a risky setup. They faced challenges like geopolitical restrictions, shipping delays, and inventory shortages. To fix this, they qualified a second supplier, updated quality agreements, and ran comparative validation studies. They also boosted safety stock and introduced digital monitoring for suppliers. The result: continuous product availability, no regulatory issues, and a stronger, more reliable business overall. Looking ahead, supplier oversight in pharmaceuticals is evolving fast. We're seeing AI step in to predict risks before they become problems. Continuous monitoring of supplier performance is becoming the norm. Environmental, social, and governance factors are now part of the equation. Digital tools like quality management systems and blockchain bring transparency and security. Predictive logistics help streamline operations. Cybersecurity checks for suppliers are critical. And regulators want us to be proactive, not just reacting, but anticipating and managing risks across the entire supply chain. As we wrap up, let's remember that supplier oversight isn't just a procurement task, it's a strategic quality function. By focusing on risk-based supplier qualification, we ensure consistent product quality and protect patient safety. Strong quality agreements, audits, digital monitoring, and business continuity plans all build resilience. When we integrate global standards and digital tools, we create a transparent, inspection-ready supply chain. Organizations with this kind of resilience handle disruptions better and keep medicines flowing to patients without interruption. To wrap up, here are the key references that have guided our discussion. We've drawn from international standards like ICH Q9 and Q10, which focus on quality risk management and pharmaceutical quality systems. We've also looked at regulatory frameworks from the FDA and the European Medicines Agency. Plus, global guidelines from the WHO, PIC-S, and ISO 9001 all play a crucial role in shaping best practices. These references ensure that what we're doing is grounded in trusted, widely accepted standards. That brings us to the end. For any further support or questions, please don't hesitate to reach out. Thank you for your time and attention. It's been a pleasure sharing this with you today. This video was created with SlideSpeak. Visit SlideSpeak to turn your presentations into engaging AI-narrated videos.